Good afternoon for those watching in the UK. I'm Dr. Neha Mistry, and I have literally just jumped on a live because, well, it was pre-planned, but yeah, I didn't manage to let you all know. So I'm just waiting for things to start rolling. Hello. Hi. I'm standing up. Oh, sugar just dropped something. How is everyone? Sunday vibes. I know I dropped some USB. What's the topic? Okay, so the topic blah, 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 blah. The topic is we are going to be exploring therapist matching. Okay, so therapist matching is something that has been a bit of an interesting conversation point for us within the field, and I'm going to be waiting for my friend, my Instagram friend, to join, Neha, and we're going to just chat about this because I think it's really important. We forget. Yeah, so we're going to touch on cultural sensitivity. So I'll be interested to hear what you think about our conversation. So yeah, let's see. And if you've got any questions with regards to therapist matching, cultural sensitivity in therapy, there's tons that we can start to think about. So I'll just wait for Neha to join. Besides that, how has everyone been? UK is opening up, so I'm finding that we're kind of getting out and about a bit more, which is quite nice. Nice of everyone to join. Hi, Shaista. Yeah. Yep. There we go. Neha is joining, so let's go live. And thank you for your questions. I'll try my best to respond as we go along. Hi, Neha. How are you?
Doing good. How are you?
I'm all right. I've just had a busy-ish morning teaching. So I've done that and had a bit to eat, and now I'm back here again. So
Coffee? I'm ready.
we're ready. I've just had a cup of tea. I've had nice masala waro chai, so a nice cup of Indian tea, and now I'm having a water. So
Can't
Neha,
have chai.
say that again.
I said I can't have chai right now. I'm waiting for it.
Oh,
Yeah,
wow.
waiting
Yes,
for
I'm
it.
sure you'll enjoy it. Do you have your
Yes.
coffee in the morning, right?
Just having coffee for now. Otherwise, it would have been
Awesome. Okay, so you know what? Before we even get stuck into it,
yeah.
let's just introduce ourselves. I mean, those people who are joining know who I am. I'm Tina Mistry. I'm a clinical psychologist. I work in private practice in the UK. I work mainly with South Asian people. I've got a couple of projects happening. The Another Mother Stories. Please check us out on Instagram. And also on June the 1st, we'll be launching the Brown Therapist Network. Please do check that out as well. And I'll talk a little bit more about that later on too. So tell us about you, Neha.
Also, that's exciting. You have a lot going on. I know we talked about it briefly before, but hi, Freya. It's awesome. It's good. So I'm named doctoral fellow, my doctorate in clinical and school psychology. So I'm in the US. I've recently become more independent because I've been in school for a long time. For 2 years now, I've been working with veterans. So I work with the military here. Sorry. I work with military veterans. Really great. I have a background in neuropsychology, but I've slowly transitioned to trauma work. And the hope is, like I did research with South Asians in graduate school. So the hope is to continue working with get more training in trauma so that we can bring more trauma-informed care to the South. So that's
Okay.
yes.
So trauma is your bag, a bit similar to kind of what I have worked in for some time now, and it's really, I guess our conversation is, I mentioned it earlier for those people who joined, we're talking about like therapist matching and the whole sort of idea around how there seems to be now this idea that having a therapist who is the same background as yourself is the ideal. It's the way forward. And I think I guess we just want to have a gentle conversation around it, the pros and cons, and really just open up the conversation that it's not just right, you have to have an Asian therapist because you're Asian.
Yeah.
Tell me a bit about kind of what your thoughts were around this when we just started to have a conversation about this, really.
So I mean, we had this couple of weeks ago, right? I think,
Oh.
yeah, we talked a couple of weeks ago. And when I was in graduate school, and I think for many U.S. programs, not all, but for many U.S. programs, cultural competency is highly emphasized. And what cultural competency is like when you're working with a person, be more aware, to be curious about what they're coming in with, who they're coming in. Culture is just one part of our identity. We have other identities as well. We have a sexual identity. Just it, I can go on about the type of identity. And for us to, as therapists, right away assume that, oh, South Asian, okay, all right, probably have rates of this, you probably have a high prevalence rate of this is probably what you go through. You're assuming. And if we think about it from a client's stance, they kind of do the same. Like, oh, you're a white clinician or you're a Black clinician, you're not South Asian, you're never going to understand what I go through. And there are some things that, yes, clinicians can definitely. But say, for instance, I was working with you. We have the same last name, right? If I was working with you, knowing that you have the same last name as me, we still have different experiences. You're in the UK, I'm in the US. The way I value my identity is going to be so different than yours. So essentially, working with Asians, one of the things that we look at, that's one of the things we want to assess, is what is the dominant identity that you carry? Do you feel, I hear this a lot among the South Asian, and I've probably said it myself in my 20s. Oh, well, I'm Indian, but I'm not like really Indian. I feel like I have more American values. I feel like I'm just more American. That's referring to saturation. Is which identity, which one do you feel like you carry more value of? And it changes. It's fluid across community. So that's essentially, what we talked about.
Yeah. And it's a tricky one, isn't it? Because there's no right or wrong answer in this discussion. Is essentially what we're saying is that therapist matching, from what the research has shown, actually has come out with very mixed results. And there's a reason for that. For these very specific reasons. My screen just keeps going black for some odd reason. I don't know why. It seems to be cutting out. And, ultimately, the key contributing factor for good outcomes, best outcomes of therapy is therapeutic alliance. It's a bit of a fancy word, isn't it? And what we're saying, therapeutic alliance, it is, it's a bit fancy, it's a bit snazzy. So let's break it down for people who are listening. What is therapeutic alliance? How do we even describe it?
Yeah. Essentially, either it's interchangeable, right? We say therapeutic alliance, therapeutic relationship. The moment you step into the room with your therapist, the therapeutic relationship begins, right? And it begins primarily with how the therapist is carrying themselves. Are they curious? Are they wanting going on? Are they empathic? Do they genuine? That's how the relationship starts. So we see safe space, and probably all the and other areas on the internet when it refers to therapy. That's actually what it is when you are vulnerable, when you're sharing the parts of you that you may have never shared, right? I'm sure you've been there as well, where you hear clients saying, wow, or I'm so nervous to share this with you. The moment they start to take steps to go forward and share those things, it's because of the therapeutic relationship, taking a risk, right? They're taking a risk trying to get to know the other person while also opening up themselves. And they're
Mm.
revealing whole parts. They're taking it by assessing, can this person respond well? Can this person hold the space? Do I feel secure, or will I be ashamed? Will I be told I'll be feeling okay? Or that's not true? Or will I be told what happened after I went? So when we talk about therapeutic alliance, that's what it is. It's the relationship between the client and the clinician.
Mm.
And something that I feel like I work better in. And I will never serve ever. I'm never gonna know how it feels to be deployed for months, years, not be able to see my family, miss the big moments that my family's going through.
Mm.
Constantly, they're also worried about me. I'm never going to know what it feels like. But what I do know is it feels scared, to feel happy, to feel lonely, to feel disgusted. I do not feel rejected. These are human emotions, and that's what we're working with. So when it comes to the therapy science, can we foster that? Can we facilitate that without always being about race, culture, ethnicity? It's a balance of both. I would definitely say that there are people in this field as well who don't pay attention, who don't pay attention to the fact that, hey, for this person, their culture is very important to them. And the do is not going to be as simple as, well, maybe you should stop out. Maybe you should just stop talking to that family member. It doesn't work that way, but I'm sure you know that as well.
Mm. Mm.
Yeah.
Yeah. We've just had
Yeah.
a bit of feedback that your connection is a little bit glitchy. Thanks,
Oh,
Saba. And who was it that said it? Shadow of the Blues. Thank you. Yeah, so I'm hoping that we can get a better connection with Neha. But essentially, what she, in summary, was sort of saying is that
oh
as
no.
therapists, can you hear me? You're right. Are you okay, Neha?
Yes, I can hear you. Yes, but I'm
Yeah.
recognizing exactly saying that my connection is not that great. Is it
Oh, okay. You're almost like when you talk, it's kind of like that. So I guess what I just wanted to pick up on was now with this new wave of all us therapists being present on Instagram, the therapeutic alliance in many ways starts way, way before then. People
yeah,
are knowing us. People like, people who are watching this, watching us are getting kind of having somewhat of a relationship with us. They can see us, we're putting stuff out there, and you guys are pretty much just understanding who we're about in many ways. And it's really hard, isn't it? Because then you come into therapy with some sort of expectation around, okay, so this is what Tina's about, this is what Neha's about. And it starts from there, which is really fascinating and interesting, because pre Instagram and pre sort of, us therapists putting ourselves out there, we never really had that. You would be assigned a therapist, you would then go see that therapist, and that first session that you have with them is the first time you meet them
right.
and you start to build a relationship. But I know that within private practice, one of the standard things that we do is offer a 15-minute consultation. So again, it starts from pre-therapy as well. And
Yeah.
and this is the thing, isn't it? Like, I use the analogy of like trying on a pair of shoes. You've seen the shoes you really want. Like, I want those shoes, right? And I've had my eye on them for ages, and I'm going to go to the shop and I'm going to try them on. And that's good. That's what you should do. Go and try those shoes on, right? But you might see another pair of shoes, think, oh, they're a bit all right as well. Let me see, try them. And that's the thing that I encourage, right? Encourage you to try on as many shoes as possible. Get to know people that you think you feel like you've got some sort of connection to. And that's the thing. It's different now that therapy has somewhat, it's become so much more open and
Yeah.
more, we've come out of our therapy practicing offices and we are now in the public realm, which never was the case back in the day when I was, training. It was like, oh, you don't do this. You just hide in a little room and you expect your clients to come to you. But this is where we're seeing a change, that people are actually having more control and choice over the type of therapist they want. And I hear what you're saying, that, there seems to be this huge wave that just because you're Asian, you need to have an Asian therapist, and maybe not, and that's the thing is what you're saying is that essentially what we're trying to do is get to know you, get to know your story. And some people may try to connect to your story, that you might have a connection without even realizing it. You might be from a different culture, you might be from a different race, you might be from a different country, but it's that connection that you hope will occur. And the therapist has to do a really difficult job of trying to really go inwards and open themselves out to that experience. And this is why I think as therapists we have a responsibility of knowing what we can open ourselves up to and what we can't, and I'm very clear on that. I know what I can open myself up to and what I can't. I know after so long of doing this, it's like, right, I can do this, but I definitely can't do that. I just can't connect to that. I just don't have a deep understanding of it. And it's really fascinating how you talk about veterans, soldiers, that I sort of started doing my work when I first kind of qualified within single event traumas. And this was like, I was working with a charity that worked with families who had experienced one of their family members being murdered. Now, I will never touch wood. I say never, I never say never, but I pray to God that I never, experience what that feels like.
Right.
But as a therapist, that took me to places where, it was deep. That work was so deep and so raw. You go to your depth of your human experience, where you just open up your heart to that family that need you, and that person who is clearly traumatized by the loss of somebody, so this is what we are trained to do. But just because I haven't experienced that type of loss, just because I've not experienced that type of grief or that trauma, that doesn't mean that I can't work with that, that experience. And most of my clients prior to working within this specific field of South Asian mental health, I worked with white clients, excuse me. So I would hope that I have done a good enough job with each and every one of them. And it does make me wonder that me sat in front of them as a brown woman, they didn't think, oh my gosh, she's brown, how's she going to know what it's like to be a white person? And that's really, it's really interesting, isn't it, how we can start to put these barriers up for ourselves. And I guess what we're always kind of saying is, let's just challenge these ideas a little bit. Let's open up our thinking a little bit more, because it's not black and white. It's not either or. It's trying to find some sort of middle ground, because the reality is that there's probably not enough South Asian therapists out there. In reality, there isn't. We are aplenty, but we're probably just not enough to make sure that everybody who's looking for therapy is going to have a brown therapist. Our job is really to educate. Our job is to, just like the Black community is doing for all therapists out there of color and white therapists, to understand the Black experience. This is where we need to do our learning, and we need to do our unlearning around what we think and how trauma and kind of mental health has been formed in our communities, so that all professionals can learn from this. It's not just brown therapists who will understand that, because like you said, you live in the States, I live in the UK. I don't know what it's like to live as a brown person in the US. might
Right,
be the same, might be really different, you know.
right.
And as therapists, you know, we can get it wrong too. Like I can count more than, you know, my fingers of how many times I've got it wrong in the therapy room. Many
Yeah,
times. I might make a kind of judgment. I'll be like, oh, so, you know, did so and so and so and so happen to you? Is that kind of what was happening? And they'll be like, no, no, it wasn't. I'm like, oh, okay, my bad, you know. So
right.
it's really important that we've got to be aware as therapists of our own assumptions and biases, because we're going to hold them, right?
Yeah,
As a Gujarati Hindu woman living in the UK, I'm going to have a particular way of seeing the world, right? That's my particular way. But just because I'm brown and then I see somebody who's got a very similar kind of background to me doesn't necessarily mean that it's going to be the same. It's
no,
not.
no.
And
And
I know that from firsthand experience.
absolutely, I think we can agree that that's the case as clinicians. But I think on my end, I've worked with clinicians for myself, right? Like that's a good thing. I think that caring about as well is that we support you, not have. It doesn't matter why we go at the end of the
Mhm.
day. For us to have, for us to also feel supported in this field is also very important because we do some deep work. We do some tough work. So I think when I've tried to work with clinicians myself, it happened to be that, and not once did it cross my mind that, oh, whoa, you're not you're not South Asian. It's more of just like maybe you misheard, maybe you didn't get it right, right? But it really is a back. So as a client, if you're working with a provider who's not South Asian, or somebody, or you prefer somebody to have the same background. I know um, for some clients who are more who, like LGBTQ, right? They prefer somebody who's more, perhaps they want a clinician so aware of things of different factors, but we have a role as clients as well. Learning how to advocate for our needs. We're not so comfortable with doing it outside of the therapy room. That also begins in the therapy. Learn. Oh wait, no, you heard me wrong. It really is a back and forth process. Oh, okay. I think my connection's not good at all. Is that okay?
Yeah, it's coming in and out. So what I picked up on was, you know, how actually as clients, our job is to advocate for ourselves, you know, and that's the thing I've seen that, you know, the clients that I've worked with that have really done that for themselves. Like, I'm like, wow, this is so great because what they teach me is the power of speaking out and standing up for yourselves and drawing boundaries and saying no, actually, because I'm brown doesn't necessarily mean that I, you know, believe in certain things. I don't believe in certain things. So actually my version of brown is totally different to yours, you know, and that's okay, you know. This is where we test things out, and the power of the therapy room is where you get to test things out. Um, and as long as the relationship between you and the therapist is safe enough, that is what, you know, is the crucial bit, I guess. Neha has sadly kind of gone. I'm just going to go to some questions. Can you summarize the therapeutic alliance again? It was hard to hear. Yeah, I will. So I'm going to see if I can find a technical term for therapeutic alliance. Let me just see. So therapeutic alliance is essentially the relationship you have with your therapist. It's when you are kind of attune with each other, and what we mean by that is like you're okay, you're safe enough with them, so they're validating you and your experience, and you feel safe enough with them, and that's essentially what it is. And it's not a perfect relationship as well, and that's something that I want to remind you, that therapists screw up, and you know what, it's good for us to screw up because we don't want you to put us on this pedestal. Actually, what you should be aiming for is a relationship where you can say, actually, you've got that wrong, that's so wrong about me, or you've made an assumption, and you know, it's about feeling safe enough to challenge your therapist, because that's your therapist's job, is to um, hold everything and be okay with that, and to challenge you back as well. So that's what we're aiming for, really, is a relationship that you feel safe and oh, there we go. I'm just going to add Neha on again. Safe enough to be challenged and to challenge as well. Let's see if that's any better. Neha, how are you doing? You okay? It's still glitchy.
Oh my gosh.
We'll just kind of have to make do. Um, I mean, are there any other points that you wanted to add, Neha?
Um, no, I think that's part. I know that exactly. It shows that it's mixed, right? It's like mixed findings in
Mm,
of
mm, mm,
therapist matching in terms of background. For some, it may like premature termination. So they may not, the likelihood of them coming out might decrease. But at the end of the day, the outcome, what's the word? The outcome of like a positive treatment, that's the part that,
mm,
and I often hear as well is I have to get to know somebody again. Like there's so much that go into the therapy relationship. But research also indicates this. I've been reading a lot about this lately, studying, is that when a therapist practices humility and has some awareness different different things across different cultures, um, it's a good thing for the, but when they don't and the client perhaps knows a little more and is more aware and pays more attention to cultural points, the alliance doesn't really work, the relationship doesn't really work. So as therapists, we want to be more in, period. When it's equal, that's when the best work is done. For it to be equal, maybe we can encourage clients to advocate for the, to speak up for themselves, because that's when it really works out. I can say, even as a clinician who works with veterans now, for me to assume that they're all that they were served, it's terrible to assume that. I have to get to know how that was for you. Like, oh man, you really got to some big events, so that's great for you. Or this was the best of your life. Never go until I ask more questions. So essentially, what somebody else said right there, yes, relatability,
mm,
right, and functional disclosure.
mm,
Disclosure, the sense of you're not being overtelling, you're not oversharing things, but you're sharing just enough that it's making a difference and for the space,
mm,
essentially.
agree. I think that's quite important, isn't it? That to have somebody who can show that they get it. And this is often what happens, isn't it? People assume that, yeah, so Sabiha says that not assuming every brown girl's experience is identical. And it's not, let's face it. It's so not, you know,
Yeah,
so different.
yeah,
And
yeah.
this is where, as therapists, we should always hold space for curiosity, always have this sort of idea of not knowing is a good position, you know, in many ways, but also be willing to do the work as well if we don't understand something. You know,
Yep.
that I'm always saying to clients, you know, if you've got some reading about a specific topic that you know about that I don't know about, please tell me, and I will do my best to try and, you know, learn about it, because I don't know everything, and I am so okay with that. And it really is about sort of valuing knowledge. Knowledge is wisdom, right? And that's essentially what is going to guide us. But like you said, it's got to be a meeting in the middle as well. You know that
Yeah.
we're
And right, like if I don't know something, please help me understand.
mm,
And even more so than that, sometimes our clients share the biggest appreciation for the fact that we try. You know, it's like, I know you may not fully understand what I'm going through, but I'm so appreciative that you try. Like, we might be the first people that have tried
mm,
to get to know them. So it's it's little things like this that really make a big difference. Is it's trying between both ends, trying to be open to the yes, this therapist is different, and I might be judging and learning to go. Um, there's like development models in research, and something that they find for some folks who actually pursue therapy and attribute all of their issues, if you want to call it that, their experiences to race, culture, eventually, as they open up, what they might ultimately work toward or gravitate toward is the world, right? Learning to shed those labels, shed those identities, and connecting on. So initially, when they're going in with this happens in my culture, then they may seek a therapist South Asian. But as they do the work, as they get to know themselves better, they open themselves up, eventually look for a therapist where they can just connect. And that's really meaningful. We think about it, that can really help us toward oppression, toward racism. We want to connect with people based on simply the fact that we're human.
Mm.
To connect only by group, only by label. So for me, I think it's interesting. Like something that I often share with my clients as soon as I meet them, I say, as we take an hour and a half, because usually our intake is about an hour and a half, I say, I want you to just keep in mind, like, to me. Just think about it. Am I comfortable with her? Like, does she understand things? And at the end, if you feel like I'm not so sure, see if you want to work with somebody else. But most, just by saying to them that I just want you to keep in mind what it's like to be with me, I think it's a discussion and it's a sign that this person really cares that this works out.
Yeah.
So yeah.
Yeah, good point. Essentially what we're saying is it is the human connection. It's whether you do feel safe with this person. Yeah, absolutely. And that's what I say to anybody who's looking for a therapist, that get to know the therapist. Do you feel like they get you? Do you feel like there is a connection? Because goodness, who knows who you can find a connection with? You just don't know, do you? And it's only when you sit with them or be in the space with them that you really feel like, oh gosh, wow, this is amazing. I feel so safe here. And it's, it's something that it's only when you pay attention to it that you start to realize, actually, tuning into your body, listening for all those cues. I feel good here. I feel like this person is so willing to come into my world, and this is all instinctual stuff, isn't it? We're just guided by that, and it's really about just being open to that.
Right.
I'm just looking at some comments, Neha. I'm just going to see if I've missed anything. Bear with me.
Have any questions?
Yeah. So I think we had a comment about therapists on Instagram.
Let me know what you see, because I had to keep.
Yeah, I couldn't carry on anything about the therapy. I don't know. Okay. So we just had a few comments around. Okay, post-COVID stress disorder. I love these. I love these new diagnoses. They're great, aren't they? Not quite sure what you're asking, but yes, we can all feel stressed right now. It's very real. Let's accept it that this, what we are all going through, is a collective trauma. Yeah. It is. And we're all going to experience things very differently. We're going to have different losses, each and every one of us. Some of us will lose jobs, will lose loved ones, so that's going to feel different to somebody who's, not lost anything, and actually their business may have thrived, or they might be fine. So it's very different for each and every one of us. Let's have a look. Vulnerability by Brené Brown. Yeah. Any cure for personality traits, negative ones? I love that. It's a good question. Personality traits. I literally did a teaching session an hour or so ago. And personality traits are what they are, traits. That they're part of who the person is. based on and shaped by the environment that they have been in. So it's not something that sadly we can manipulate in many ways, you know. And you wrote besides CBT, narcissistic traits. That
Yeah.
is something that you just, yeah, you know, if that is yourself that you're noticing about yourself, that's something you have to work through. You know, it's
Right.
time, it's relationship as well, essentially, because if it's personality, it's got to be done in a relationship.
Yes.
So
That's
you
what I
need,
that it comes down to relationship,
mm,
personal, interpersonal stuff. But
absolutely.
CBT is very effective for for that, and so is psycho. But again, that also comes down to working with a therapist. And this takes part of it is the acceptance of not you're not who you are as a person. So when it comes to working with personality, we really want to keep that in mind. What we don't want to lose is who we are. We don't want to lose that therapy room. Maybe what we want to lose, the little patterns, the little things that we do that hurt us. Maybe that's what we want to learn to let go of. Yes, peace out to you as well.
Oh.
But yeah, you know, I thought of something and completely, completely forgot. It was regarding earlier, but
Mm.
yeah, I forgot was. But yeah, no, this was a great discussion. I just feel like so many people today, I get a lot from many South Asians who are all across the world and who something specific is like, I want a South Asian provider, blah, blah. Maybe I remember now. Maybe it's because I had a bad experience with a therapist before, and the therapist makes suggestions or make comments that were judgmental, that were shaming. It
Mm.
comes down to that. What's important to keep in mind is that that didn't happen because this person is not South Asian. That happened because it was not curious, right? And that's so important to find is that when somebody you, it's not because it's oh they're understand. It's because they didn't want to understand. And if we think about it in our lives, we go through that. There are people, everybody's lives, who don't want to understand what they're going through, and they could be their own family. It has nothing to do with the fact their background is. It's just they didn't want to, or they weren't aware they should have, or whatever. But yes, therapist matching is it's complex.
Yeah,
Just
and I think that a lot of people may also have had a, you know, South Asian therapist and feel like there just wasn't a connection, that the South Asian therapists themselves just didn't want to meet their client where they needed to be met. So it can happen within as well. None of us are perfect, you know, and we're going to click with some people and we're not going to click with some people. It's
yeah,
just how it is, and we have to accept that it's hard, isn't it? Because I wish I could just say to people, oh yes, this is the perfect
yeah,
therapist for
yeah,
you, you know, but it really is trial and error, and that belief that, you know, if you really want to heal, and you got to find your people, find your
yeah,
people, just like how we find our friends.
yeah,
You know, it's a journey, isn't it? Sometimes you get some really rubbish friends, and sometimes you have these amazing friends that, you know, they're for life and they get you and you get them, and it's just easy, and that's how it is.
yeah,
Relationships are essentially all the same in that way, that it's
yeah,
trust, it's safety, it's connection, it's that reciprocal kind of dynamic that happens between you and the therapist. You
mm,
both have to put in the work in order for the relationship to flourish.
right, yeah. And I don't know how much is conveyed on social media. I truly don't, because I feel so social media is difficult. It's hard, right? It's hard to even share certain things about therapy, about disorders, because you can't condense it and simplify it into a post. Like, yeah. So it's very layered. It's very layered, definitely.
Yeah,
But
I think that the hardest part about therapy is it's just this mystical thing, isn't it, that happens, and you're like, "Woo, it's all woo woo," and it's like,
yeah,
"What's happening here?" And we can't describe it. You have to,
it's an energy in the room. I always say that. There's an
yeah,
energy.
yeah, and it is, isn't it? It's when you have been in the presence of people who truly want to connect with you and you feel safe enough to connect with them, that's where this magic happens in many ways. This connection, this warmth, this love,
Yeah,
this stuff. And
yeah,
we know that it works,
yeah, yeah.
you know.
It's true. True.
Um,
It takes time, right? But people want quick, and I think maybe that's part of it. Is the therapist matching comes from this inner desire. Is that if you're the you're imagined, and if you're the therapist that I imagine, that this will speed us.
yeah, yeah,
So, and if that's something for you, then that's something to think about and
mm,
reflect
yeah.
with therapist. Yeah, yeah. But yeah, this was a great conversation.
Well, thank
I
you,
really
everyone,
yes, thank you.
joining. Thank you, Neha, for this impromptu, what felt like an impromptu conversation, but we've been obviously clearly thinking about this in the background. If if please do, drop us a message if you feel like that you want to have us to have more of a discussion around this, because it feels like there's more to it than what we just suggested anyway. um and yeah, hope you have a good rest of your day. It's
Thank
sort of 3 o'clock in the afternoon here in the UK. I'm squinting my eyes. You can tell my old age is happening here.
you.
And what time's it over there where you are, Neha?
It's 9 a.m.
9 early vibes. Okay, so Sunday morning, early, right. And if
It's
people want to get in touch with you, where can they find you? Obviously, this is
um
important.
so Instagram is fine. You can definitely DM me. I try my best to DMs as I can. It's really crazy with as well is I encourage my followers to talk and comment and they oftentimes don't. And they'll DM. And it's well, we're doing exactly what we don't want to do, right? You want to not stigma, you want to end the stigma, but you're not talking about it. So if anything, we're just feedback loop where it's like, oh, I want to end the stigma. I'm this person privately. I won't openly comment, ask. Sometimes even just asking questions or making a comment is an effort toward destigmatizing mental health.
Mm.
So yeah, and that's everybody has mental health. Everybody, right?
Yep.
Not everybody has mental. Everybody has mental health. So if everybody has mental health, we should talk. As
Yeah.
simply as that.
Yeah.
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 Exactly. And it's tricky, isn't it? Because I still feel like there is a lot of work that we have to do in
Yeah.
terms of trying to create these safer spaces, and being on a public platform like Instagram, Facebook, whatever it is, it does,
Right.
it's very vulnerable, isn't it? You do feel quite like, oh my gosh, I've just put myself out there.
Right.
And
Putting
for
up
the world to see,
yes,
yeah.
sharing my deepest, darkest
Yeah.
secrets. But in actuality, it could just be a simple question, like what he asked her is like, can you work with narcissistic personality traits? It's a good question, right?
Right.
And many probably thinking it, but you spoke up
Yeah.
and you made a difference by asking that question and maybe helping many.
Yes.
Yeah, yeah,
Absolutely.
yeah, yeah.
Ask questions. This is what we're here for. We're trying to,
Yes,
do our best. We can't read people's minds. Guess what? We can't. We're psychologists. We can't read your mind.
yes.
Yeah.
My post is your partner, even referring to relationships, but in general, even your therapist,
Yeah.
we can read minds, right?
Yeah.
Psychology and behavior, so we start to understand what behavioral patterns are. But even then, I can't read your mind. I can't predict your behaviors either.
Exactly.
Yeah, yes, no problem. Is it Sabiha or is it? I wonder if I'm saying it right. But
Yes, Abiha. Lovely.
Sabiha, okay. Thank you for joining.
Yeah. Thank you, everyone. Okay. So you can find me on Brown Psychologist
Yes,
and Shades of Brown Therapy.
yes, I'll be there. Not moving.
Have a lovely rest of your day, everybody. Thank you for joining and take care.
Awesome. Bye bye.